Hi, I'm Dr. Max Lingenfelter, and welcome to our video on what is arthritis of the hip. In order to understand what arthritis is, we need to first understand what cartilage is. Cartilage is the protective coating on the mobile ends of bones that lives between the ball and socket joint of the hip. It allows the joint to move and pivot with zero friction and zero pain under normal conditions. Here's an example of a normal hip x-ray where the healthy cartilage resides in the joint space, protecting the ball from the socket. And even though this patient is bearing weight during the x-ray, the bones are protected from each other and not allowed to touch. Here's an example of the appearance of real healthy cartilage. You can see it is simply a covering overlying the end of the bone, where it must provide motion against another bone. When it's healthy, it is actually 100 times slicker than ice on ice. Here's an example of a cross-section of bone indicating this cartilage has grown quite thin, but is still protecting the underlying bone, which is very important because that's where the pain fibers and nerve endings live. And why is this material, articular cartilage, so important? Because arthritis is a result of loss of this cartilage. This can result from normal wear and tear, traumatic injury, a misaligned joint, or prior surgical repair, or from a labral injury that may have required surgery. This is what it looks like inside of the hip joint after that process has occurred, and arthritis has severely affected the quality of the cartilage on the femoral head, or the ball of the ball and socket joint of the hip. You can see potholes in the cartilage here, with exposed bone visible underneath any remaining cartilage. You can also see inflamed and irritated tissue from the disease process. How is arthritis visualized? It can be seen on x-ray, such as these examples. Here's an example of mild, moderate, and severe arthritis. In each subsequent example, you can see the cartilage becoming thinner and the bony surfaces coming closer to each other. Or it can be seen on MRI. Here's a normal hip indicating consistent dark signal in the healthy bone of the ball and socket joint. Here is an example of severe arthritis, evident by bone marrow edema or bruising of the bone, which is the white signal, indicating there is stress and damage to the bone, which occurs after that protective layer is lost, and these two rough surfaces are contacting each other. Why does arthritis hurt? Well, bones are tough and made to support heavy structures like our bodies. Cartilage is soft, resilient, and bouncy. When the cartilage wears down and these bones touch each other, this results in significant pain. This is because bones are built with many nerve endings which can transmit pain. Cartilage is made with no nerve endings, which is why you don't feel anything when joints are working properly. There are multiple other sources of pain that can sometimes mimic or confuse our brains into thinking it is our hip joint causing pain. The most common one is low back pain. If your pain is primarily located in the buttock, posterior region, or near the low back area, it is most likely coming from low back muscles. This is typically treated with medication and physical therapy. If your pain is primarily located on the outside of the hip and coincides with extreme tenderness on the outside, then it is most likely coming from bursitis, which is treated with cream, injection, and physical therapy. If the pain runs down your leg, particularly if it goes below your knee into your foot, or is associated with numbness or tingling, then it is most likely a pinched nerve being the culprit. This would be treated with medicine, physical therapy, MRI, and possibly an injection. This is in contrast to hip arthritis, which is manifest primarily as groin pain. And that is because the hip joint is actually much closer to the front of the body and the groin than the back. In fact, there are many patients who come in thinking they have a groin pull when in fact they have hip arthritis, which is what we will talk about in our next video. This has been our video on hip arthritis. Stay tuned for our next video on how we treat that arthritis. If this has been helpful and informative, please like and share with your friends and family and anyone who could benefit.